Hello. Today I'm going to provide a demonstration on starting an IV on the pediatric patient, and then I will talk about how to give injections to the child, sub-Q and IM injections. First thing we'll do is start with the IV starts, and we always get our supplies first, our IV start kit, our IV catheter, and for our child we're going to go with the 22 gauge, an extension set on the IV, needle and syringe to drop saline so that we can flush the extension set. But the first thing I'm going to do once I come in and have all my supplies and explain to the patient on what I'm going to do, I'm going to locate a site that will be viable to start the IV. So I'm going to get my IV start kit and take out the tourniquet. I'm going to tie the tourniquet about 6 inches or so above the site where I'm going to want to start the IV. Palpate for a good vein. Okay, when I find the location that I want, I'm going to release the tourniquet and just leave it there. Chloroprep out of the kit so that I can clean the site first thing. And then I'm going to allow it to dry while I get the rest of the supplies ready. I'm going to loosen the tip off of the adapter on the end so that when I'm ready to get it, it will just come off and I don't have to try to undo it with one hand. Drop about 2 cc's of saline. And this is called a twin pack. It's not a needle. I'm going to recap this side, open the other side. And then insert it and flush the extension tubing. Once it's gone through, I will just leave it here. Okay, now that we're ready, I'm going to retie the tourniquet. Okay, and avoid touching the site that's been cleaned where I want to insert the catheter. Okay, hold the vein taut. Go in at a 10 to 15 degree angle. And when I'm in, advance it, the catheter a little more, and then thread the catheter along the needle. Okay, and when it's all the way to the hub, release the tourniquet, occlude the vein, retract the needle, and connect flush the extension set. Okay, clamp the tubing, and at this time I'll just put a small piece of tape just to hold it in place so that it doesn't get dislodged while I'm taping over the site, because we don't want to touch the site with anything that is not considered sterile or unclean, because we don't want anything to risk their infection. Okay, so now once I've got the tegaderm over the site, I want to put a label on date and time and initial when it was started so that whoever is following me knows when this was started, and then secure the extension set. And then the site is ready for either intermittent medication or to attach IV tubing for continuous infusion. For injections in our pediatric patients, The sites are going to be just a little bit different than we'll do with adults. And for the sub-Q injections, we're going to focus on the leg. Okay, now we're going to do the IM injection. And for the children, the IM injection sites are the vastus lateralis in the legs or the deltoid. And if we're going to give injections in the deltoid, we want to limit the amount that's given to no more than 1 milliliter. So we're going to go ahead and prepare our medication to administer in his vastus lateralis. Needle to the syringe. If the vial's previously been opened, we want to swab the top of the vial. And as with our sub-Q injection, we want to make sure we put air in the syringe for the amount that we're going to withdraw. Inject straight in the middle. Inject our air. Invert, making sure that the tip of the needle is in the liquid in the vial so that we don't get air. It limits the amount of air that we're going to get. Draw up our medication. You can always draw up more than what you need, especially while the needle is in the vial. And then advance the plunger to get rid of the excess and make sure that there's no air bubbles. And if there are, then we would gently tap below the area of the bubble so that it could go to the top so that we can expel it. Okay, so now that we're ready, we can go ahead and give the injection to the patient. And with IM, we're going to use the Z-Track method. And what that is that after we clean, we allow it to dry, and then we're going to pull the skin taut to the side with our hands, go in at a 90-degree angle of insertion with the needle, straight in. We want to aspirate, make sure we're not getting blood, and then slowly inject the medication. Remove the needle, and then let the skin go back and hold gentle pressure. We also do not massage. And on these needles, we can just flip the top until it clicks, and then it covers and protects the needle. And that is the process for the IM injection.